Yes, Angelique. Yes. Welcome.
Hi, yeah, I'm sorry, I'm unmuting here and just I'm a slow clicker, so
It's
bear with me. Hello,
welcome.
everyone. Hi. Yeah, I think this is my first time here, so thank you so much. I'm so glad I found you, and I found you via Instagram, FYI, just to kind of let you know.
Well,
I'm actually new to an MPH. I just got my degree from Purdue University online, but I'm a very seasoned woman, so to speak. My trade is I've been a nurse for 30 years as an LVN, and my journey went from we move around a lot. So I'm moving again to Atlanta. So this is our 13th move. My husband, we are not military; he's just corporate.
okay.
So yeah, that's how I have to explain it because everybody's like, "Oh, thank you for your service." No, no.
I love
So,
it.
but I worked with the Florida Department of Health throughout COVID. That kind of pivoted me away from patient care. I'm a pediatric nurse by trade. So COVID did me in, moved to COVID, and I got out of patient care. So I'm also a type 1 diabetic. So I stopped with that exposure as I'm also getting older. We moved here to California a year ago, and I got in a beautiful job working remotely with the birth defects genetic disease disorder monitoring
Okay.
with the Department of Health and the University of California, San Diego. So now unable to work remotely across state lines, unfortunately, love this job, love the people. So as a new person in NP, working with my NPH now that's been attained, I'm falling into a rut of everything is popping up nursing. So I'm glad you did the post about LinkedIn because I've been liking things. And I'm like, why is that popping up? So my background is more like I'm all about data abstracting. I can analyze, but my limitation is all of these statistics, all the biostats, the statistical things. I just don't do that. Every time I've worked with the Department of Health, and here in California, we have a dedicated statisticians, biostat people who take that information I'm gleaming and they work with it. So yes, I know about it. I know it exists. I know I've heard of SQL, Power BI, all those things, but I haven't like worked in it. And so I guess I'm trying to figure out. And thank you this week. I've worked through all of the courses this week and leading up to coming up this Saturday so I can be prepared.
Yay.
Yay. And so my thing is I'm revamping my resume because of course 30 years, I got a 3-page resume. And so I'm trying to knock down all those things. And I was those people, I had my GPA because you know what, pat on my back, working full time, getting it done. And so I was like, oh, gotta take that off. Oh, sorry. Delete. But I'm like, hey, take your little puffer chest down, girl. You did it. You finished it. So
Exactly.
thank you. Thank you for that. And my kids are in their, they're in their late 20s and 30s, and they're all like, y'all, she's giving us gems. I need to update your resumes, So, and they've all graduated too with their degrees. But I'm trying to figure out how much do I limit or how do I parlay that into, yes, I'm a teachable person.
Ah,
I don't want to go heavy into doing, yes, I do want to. I'm looking at LinkedIn thinking, am I supposed to start taking these little certification courses of SQL, of, SPSS? We just touched on it. We just did like maybe a scenario on it. We didn't deep dive into it. And so how does someone like me get through these AI screenings when I can see I don't have that? Because here's the thing, I'm sorry, I'm rambling a little bit, ladies. I do apologize. So I will tell you, I did a Hail Mary for this Department of Health job here in California. I didn't qualify for everything. And so in the interview, when I told them, hey, I try to use the word deficit, I'm like, I am familiar with these terms when it comes to statistics and biostats. I have not done that. Immediately they said, oh, I was like, we don't need you to do that. We have a department for that. So that's how I bumped up in that interview. And out of the top 7, I was chosen. She said, you're not going to look at that. We need your data abstraction. But when I read that application, that's not the gist I got. So had I not just applied to apply, I would have taken myself out of that running because it
okay.
did say in your preferred, required, desired. Because I pulled the original job description. I kept it. I'm looking. I go, oh my gosh! If I had saw this, I would not. In my time, I think probably just because I've been 4 months without a job. I was like, let me just do it and see what happens. And of course, it took 3 months for them to get back to me.
Yes.
Um,
Yes.
but had I not done that, I would not have known that, that's not what they were feeling. But she said, what, that's an HR write-up. So I guess I'm trying to figure out, I know you've seen it. The ladies have all gone through it and if the gentleman here, I'm so sorry. Um, that how do you know to say to take that shot of like, I think Yuko mentioned it's 80%. Do I take that
Ah,
20% shot and go like, you don't know what they're looking for because who wrote up the job at?
I see. I
I'm
see.
sorry, I know I gave a lot to you.
No, 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 no. I love it. I want to still meet with you one-on-one. It sounds like it
Yes,
would
I will. I plan on it for next week. I'll look
one-on-one.
at the availability.
Perfect. And then where did you graduate from? Where did you get your MPH from?
Purdue University.
Purdue. Okay, great. And then you have a job now?
I have a job now. I work for this is my last week. I just gave notice. So Friday's my last day. So I
Oh,
work for the California Department of Health in
okay.
conjunction, in conjunction with the University of California, San Diego. So,
Okay.
so yeah, and they've been very supportive. I'm going to reach out to our affiliates who have remote positions with the Department of Health in all those areas. Texas is remote, Georgia. So I'm just doing like a little blanket email introduction. Hey, here's my background. If you have any potential openings coming, because everybody doesn't always list their openings. I know,
Okay,
you
so
think
I'm not
maybe.
understanding. I'm sorry, I'm not understanding why you quit your job.
Well, my husband got I'm sorry, I left that part out. My husband got transferred to Atlanta, so he is promoted again. So I'm on the road again.
Wonderful. Okay,
So sorry,
I'm missing something here. Okay. No, no,
because
no.
I
I
probably
just
didn't
want to
say it.
understand.
I was rambling.
No, no, it's okay. So here's the thing, Angelique. I love meeting our nurses because, this is the reality is that with a lot of us in public health, most of us don't have our medical degree, but then we do see jobs where it sounds like a public health job, and then you get to the bottom and they want a licensed medical professional. And then it's like, oh, they should have cited that at the top. Like, oh, like, so you're basically, obviously there are jobs out there for your background, someone who does have a medical background or been working with patients. Here's the reality though, is I think you just haven't given yourself enough time to really search the sort of ocean of possibilities for you. And I
Okay.
think you might be jumping to a lot of conclusions just based on what others have been experiencing. And I love that you also, you've navigated what you can and you're moving often, with your husband and you're doing, you're successful in a lot of those ways. But I feel like take a minute to just study. As you can see, like I'm glad that you're already consuming the information, but be mindful that I talk about 7 sectors that really employ us, right? And so that requires you to really dive deeper even into those. The first industries that come to mind are pharmaceutical for you. Pharma. Johnson and Johnson should be on your radar. Abbott should be on your radar. Like if you're not there, that should be where you are after this call. So
Okay.
I want you to find, if you're moving to Atlanta, what pharmaceuticals are in Atlanta.
Okay.
That's your homework assignment. Figure that out. Would love to hear what you find when we meet one-on-one. You're like, hey, these are the companies I found. What are you thinking? So at the end of the day, it could just be more that you haven't given yourself that space to be like, okay, what really is my avenue, my career track options, and that does work out best when we meet one on one. But just based on what you told me, I hear a lot of work that can be done around like data registries with like cancer
Mm-hmm.
registries. I see that rampant, just registry information. It sounds like you could do that.
Yeah.
Um, a lot around provider relations and patient relations. So if you type provider relations, if you type patient relations, there's a lot of remote options, also a lot of hybrid or on-site. So I've seen them different for different reasons. So like patient relations can be pharma, patient relations can also be hospital. Sometimes they want patient relations at a high level because of the high stakes. If it's like a certain chronic or acute disease or something that
Mm-hmm.
I do see this often with cancer, but I also see it with just rare disorders, rare diseases where they want like a very, just a professional who's comfortable in medical terminology, right?
Yeah, they're
Sometimes
doing like a lot of wellness approaches in the whole, well, I say the well-rounded, the circle, filling in the circle, taking the gaps out.
yeah,
So
they just want someone who,
preventative maintenance and curative. So yes, all.
yeah,
Mhm.
it's not so much a navigator position because I'm sure you've seen those, right? Where it's a patient navigator. Actually, I have seen really good 6-figure jobs as patient navigator that actually wants a nurse.
Mhm.
So that might be an option for you too. But what I'm talking about is sometimes they want like a patient relations specialist. And it's
Okay.
for it's a rare disorder for that hospital, but they want a nurse who's comfortable, right, in the medical terminology, or at least has some familiarity with whether it's the elderly population or children or whatever the
Right.
actual cases that they deal with.
Mhm.
So that would be hospitals again are still up your alley, but if pharma hasn't kind of rung, a
They
bell.
did. Thank you for that. I hadn't even thought about
Yeah.
that.
And I'm not
Yeah.
even talking about medical sale. Don't go into sales. It's
Yeah.
other track, right?
Right. Yeah.
Where they want you to help with partnerships and community representation and aware. Sometimes I even see that they want like a speakers bureau manager where you're just
Mhm.
like managing to people of different expert levels. and you're the remote coordinator, but you
Yeah,
pay.
the coordinator. I'm seeing that pop a bit, but I'm like, man, is that above
Yeah.
me? Is that above my level? Yeah.
It depends. It depends. So I don't want you to feel like you need to find something clinical necessarily. They could just want someone who knows how to work really well with doctors or nurses or right.
Yeah.
There's also, the third category you should look into is associations or membership-based groups for the workforce. For the workforce. So if you type workforce development or cite medical professionals when you're searching, like literally in your link, like in your search engine for LinkedIn or Indeed, try that instead to see if you find something where they want a nurse to help with like trainings or webinar or curriculum development. That's again, if you're comfortable with that,
Yeah.
right? Because we haven't met one-on-one. I'm still not sure, well, what spaces you want to be in and all of that, which is why I appreciate meeting with you one-on-one and seeing your resume more. But I'm just giving you a little bit of just hope that there are certain tracks for you, but I think you might just be running to like, notice I haven't even talked about government. I'm like, what, whatever. Like government, sure. Like you can apply to government, but I feel like with your
It's there.
background,
It's there.
yeah, I'm like with your background, like these other industries are paying more anyway. So like go there.
Right.
So, and they just have more financial security, just with those three in mind.
And that's
So,
what I'm, yeah, thank you for that. I don't
anyways,
want to,
yes,
but
yes,
yeah, no, for sure. I'm gonna clean up that resume and then
yeah.
that's
And we'll meet.
once I clean it
Yes.
up, then I'm gonna schedule with you because I want to make your the time that I use for you is just more valuable than that. So
Perfect.
thank you guys
Perfect.
for that. I'm
Yeah.
gonna still listen and I'm gonna thank you ladies. Appreciate it.
Welcome. Welcome.
Thanks for your
Yes.
time.
Okay, Zoila, can you remind me what the industries are? Do you touch on 2.0? I do, government, pharmaceutical. So I can type them out because some of them are kind of grouped, like government. If I press enter, is this shoot? Hold on. Government, hospital, health plan. And I feel like pharma's kind of no, because pharma to me is now for profit, right? It's kind of how you define it too.
And don't forget, just recently, that $7 billion award just came down on the Sackler family for Purdue. So there should be something
Oh,
that is officially done, and there's
I have
no
not
more
heard.
appeals.
Oh, wow.
Yep, done, done. Mhm. Something to watch.
Okay, I'll have to look that up. Government, nonprofits, hospital health plan, for-profit corporations. Hold on. Pharmaceutical research universities. And then my favorite is also associations, membership groups for the work. They tend to be for the workforce, not because there's nonprofits that are for a cause, and then there's like these association groups that are for the workforce or for like bringing people together, like think councils, societies, unions, things like that. You're welcome.